Hello, everyone, and welcome. My name is Erica Mayall, and I am a dance-specific physical therapist or physiotherapist, depending on what country you're coming from, in Vancouver, Canada. And I am here today to talk to you about common injuries that we see in competitive dancers. So before we get started, just a little bit of background on myself. I grew up a dancer. I mostly participated in syllabus dance classes, did exams in IST, ballet and modern and jazz and tap and all of those. And in my later years, started to do some competing. So I wasn't a really heavily competitive dancer, but definitely experienced the competitive dance world to some degree later on in my dance education. I went on after university, did a degree in kinesiology with a specialization in athletic injuries. And after that, did a master's in physiotherapy. Ever since then, I have been working in dance-specific physiotherapy, so helping dancers, mostly pre-professional and competitive dancers, helping them prevent injuries, helping them rehab from injuries that are happening, and helping them to be the best dancers they can possibly be. I also do a lot of education for dance educators, so courses and workshops, webinars, that sort of thing for dance teachers, just trying to bridge the gap between healthy dance practice and dance science and dance research and what dance teachers are encountering in a studio atmosphere. So that's just a little bit about me. I don't want to spend too much time talking about that. At the end, I will put up a contact slide if anybody wants to get in touch with me. But today I want to get into talking about common dance injuries. This list is by no means going to be exhaustive. I'm going to touch on a few different injuries that we see commonly. Just briefly, this is, again, not a substitution for medical advice. So if anybody is experiencing injuries, I really encourage you to go and get them assessed, ideally with a dance specialist. But if you are somewhere where you don't have access to somebody who specializes in dance, even finding practitioners and healthcare professionals who work with other athletes or sports populations can be really helpful as well. So this will just give you a brief overview of things that I see really commonly in the clinic and specifically in sort of adolescent competitive dancers. I'm going to do a little bit of a top-down approach. So we're going to start at the head and work our way down to the foot. I just picked sort of one injury in a variety of categories. These are in no particular order, not necessarily like the most serious, the least serious, most common, anything like that. I just wanted to touch on a variety of injuries that we see really commonly in the competitive dancer, things that might predispose dancers to these types of injuries, management strategies, and prevention type strategies. So we are going to start by talking about an injury that happens to the head. And this is an injury that doesn't get talked about a lot in the dance world, but I'm sure all of you guys have heard lots of information about concussions in the sports world. It's been in the media, in the news, but concussions are commonplace in dancers as well. And they are often undiagnosed or underdiagnosed potentially. We see concussions commonly in sort of hip hop break dancer type populations. We see them a lot in contemporary dancers who are doing a lot of floor work. We see them in improv, especially contact improv type dancers. So we see them in a variety of different types of dancers. I think everyone is probably aware that a concussion is a traumatic brain injury. Most people, though, often associate concussions with a loss of consciousness. However, only about 10% of concussions are actually accompanied by a loss of consciousness. The vast majority of concussions happen without the person ever becoming unconscious, and these are the ones that we want to be really aware of in dancers. People are often thinking about them if somebody's like hit their head or bumped their head or two dancers have collided, but concussions can also happen in a situation where there hasn't been a direct blow to the head, but there's a force that's being dissipated through the spine, and you can actually get the brain sort of rattling around inside the skull, and you can get a concussion even without a direct blow to the head. And these are the ones that are often missed in the dance population. So these are similar to like a whiplash type injury. So you're doing like a layback or something where your head kind of goes backwards and then forwards. And that velocity or like acceleration that happens inside the brain happens at a different rate than how the skull is moving. And so your brain can actually like bump into one side of your skull and then bump into the other side of your skull. We call it a coup counter coup injury. And that is a common way that people can experience a concussion. And these are the ones we want to be aware of and recognize in dancers. So not necessarily the dancer who has a collision or bangs their head on the floor or gets kicked in the head or things like that. Like, yes, we need to be aware of those as well, but we're better at identifying those and not as good at identifying the ones that are maybe a non-contact concussion injury. So when we're thinking about concussions, there's all sorts of different signs and symptoms that can happen as a result of a concussion. No two concussions are alike. The brain is incredibly complicated, so they can be hard to diagnose sometimes. But really common things that you'll sometimes hear, dancers will sometimes report having a headache, a feeling of pressure in their head, potentially dizziness, being unable to concentrate, things you might observe if you are a teacher or a parent in a dancer with a concussion is they might seem a little bit less coordinated than normal. Their balance seems to be affected. They are a bit confused, maybe. They don't know where their spot is in a dance, or they're kind of always like a count behind, and that's unusual for them. So those sort of like signs and symptoms of confusion. You'll sometimes see irritability being one of the number one signs and symptoms of a concussion. So like somebody who's generally pretty happy and calm and like kind of very, very even tempered will all of a sudden become quite irritable or have like a short temper almost. That can be a sign of a concussion as well. So these are just some things to be aware of if you're thinking about signs and symptoms of a concussion in a dancer. In terms of management for concussions, concussions are quite a serious injury, even if it's a mild concussion, because the brain is so complicated. So any suspected concussion should be managed by a medical professional. There are some injuries that can quite easily be managed, like, you know, in a studio setting or with the dancer modifying what they're doing and things like that. But concussion should always be managed by a medical professional, regardless of how mild we think they are. This might be the family physician, this might be a physiotherapist, it could be an athletic trainer, it could be, in some cases, even like a psychologist, things like that. It really depends how their symptoms are presenting. And it also really depends on who in your area is familiar with and specializes in concussion. So ideally, you want to seek out someone who is familiar with rehab protocols and management protocols of concussions. With a concussion, time is one of the sort of factors that affects recovery. But there's all sorts of other things and lots of new research coming into effect in terms of how physical activity and exercise affects healing timelines and things like that. So it's really important that if you or one of your dancers or one of your friends or somebody you are with, you suspect they have a concussion, we really want to get that looked at by a medical professional. And then they're going to be the person who is like dictating the management of that. But it's just an injury I want to bring to the forefront because it doesn't get talked about a lot in the dance world, but it is actually quite common. And again, more so in dancers who are potentially doing a lot of like floor work, partner work, contact work, that type of thing. So that's first injury on our list, concussions. We're going to move our way down and talk about a couple of back and spine type issues. So the next injury I want to touch on is something that's called a spondylolisthesis. So super long, confusing name, not a super confusing sort of presentation. But these are dancers who are going to report low back pain generally, and usually when they go into extension type positions. So this is your back bend, your arabesque, your needle positions, things like that. This injury is common in gymnasts, but for a dance population, it's common in dancers who do a lot of acro or a lot of tumbling type work, a lot of kind of like chest stands, things like that. But even dancers who are just doing a lot of extension, so you can see it even in like ballet dancers and stuff who are doing a lot of arabesque and really working on improving their leg height in an arabesque or their back bend or things like that. So extension-based stuff is when people are going to report pain with this injury. I'm just going to pull up a picture here so you guys can see what this is. But essentially, what a spondylolisthesis is a slippage forward of one vertebrae that's stacked on top of the vertebrae below it. So in this image here, on the left-hand side, this is what they're calling a healthy spine. And then if you look at the spine that's one to the right of that, and they're calling this a grade 1, you can see that there's just an area where they're showing some red and kind of irritation in through here, but the vertebrae still looks like it's reasonably well stacked on top of the vertebrae below it. If we progress over to the right one more, so now we're looking at that grade 2, here they're saying there's between 25 and 50% slippage of this top vertebrae forward on this bottom vertebrae in through here. And what starts to happen with these injuries is this injury actually affects this joint at the back of the spinous processes, or the transverse processes of the spine here. And these are called the pars. And so you'll sometimes hear this called like a pars defect injury. But basically what it is this slippage forwards that starts to happen, and it causes pain and irritation through the joints and through here, and then potentially through the disc that sits in between these two vertebrae. If we go all the way over to the right-hand side, and where they're sort of looking at sort of 75% injury, what can actually happen is you end up with a fracture that occurs at this joint or at this bony process in the back in through here. And so if we get to the point where this is sort of fractured all the way through, this becomes a much harder injury to manage. This injury is much easier to manage at this stage here, where there isn't necessarily a bony defect happening at this point. There's just this mild anterior or forward slippage that's happening, and this is easier to control. So like I said, this injury is really common in people who do a lot of extension-based work. So especially like your acro or super bendy, like people have really flexible backs and like to go into extension a lot. What we want to do from a management perspective, and even from a prevention perspective, is make sure that people aren't going into those movements in an uncontrolled fashion. So it's still fine for us to go into extension, especially if you don't have any pain or any limitation in that, but it needs to be a controlled movement. So we don't want to be just like flinging ourselves into that, or I often use the term like dumping into extension. So what we need is a really strong and well-controlled torso, and especially those anterior core muscles that are going to help us control that movement into extension. For people, if they're actually experiencing this injury, and depending on the grade that they present at, we might have to limit extension temporarily while it heals. So we might say, okay, you can't do any extension activity for 2 weeks or for 4 weeks or whatever, depending on the degree of kind of like slippage in through there. But really at the end of the day, the more important treatment aspect of this is to control that extension. So if I have dancers coming into the clinic with this type of presentation, and luckily with this, I often see dancers when they're at that very first stage. So I don't see a lot of dancers at that like grade 3 or grade 4 level. They very often come in when extension stuff is like starting to get painful and irritated, but they haven't let it progress, which is fantastic, because at that point, it's really easy for us to like train how to control their extension and to really work on the strength of their core muscles to be able to control that. And we can really, really effectively manage this. If we let dancers get to the stage where they're at that like grade 4 and there's potentially like a bony defect and stuff, this becomes a lot harder to manage. And in some cases will even result in like needing surgical stabilization, where they'll go in and put some like kind of plates and screws in there to hold the vertebrae in the correct spot. So we don't want any dancer to get to that point. We want to see them when they're at that sort of like very, very first stage, if they're just starting to report kind of pain with those extension type movements in through there. So that's one of the things I want you to be aware of in terms of spinal sort of injuries that we see commonly in competitive dancers. The other thing I want to bring your attention to is something that we call a functional scoliosis. So scoliosis is a curvature of the spine that is different than our natural curvature of the spine. So rather than their spine being straight up and down, we'll sometimes see it shaped in like what we call a C curve, or sometimes we'll see what we call like an S curve. So there's a little bit of a lateral curvature that happens in the spine. In some instances, this happens naturally. We don't know why it happens, but in that case, we would call it adolescent idiopathic scoliosis, or AIS. Those are not the ones I want to talk about today. That's quite a complicated sort of pathophysiology that leads that to happening. But in some dancers, and this is what I more commonly see in the clinic, we will have what is called a functional scoliosis. So this is a curvature that develops because of a muscle imbalance that is developed. So we have muscles that are stronger on one side and potentially weaker on one side. And the strong muscles will tend to kind of like tighten down or shorten. And the weaker muscles will often become a little bit like longer and lengthened and not as strong. And that will pull on the spine kind of asymmetrically and can cause these curvatures to happen. I see this really commonly during competition season. So we'll see dancers who are training throughout like the fall. If they're not competing a lot, they're training pretty symmetrically. It's not an issue. And all of a sudden, as competition season starts to draw close, they're really ramping up how much they're rehearsing their dances. So rather than doing so many technique classes, they're doing like choreography over and over again. And generally, especially if you're doing lots of solos, but even in group stuff, it's usually choreographed for like your good side because we want to showcase where your strengths are. We're not going to choreograph something for your less flexible side or weaker side or whatever we want to call it. But we will often see these imbalances sort of develop then as a result of this. So I'm just going to show you an example of what this might show up as in terms of like what you might see. So in this, so this is looking at one of the hip muscles down below here. So this is your, actually, kind of a fake hip muscle, but anyway, what they're showing on the left-hand side is the spine in what we call like a neutral position. So it's nice straight up and down. The muscles on either side of it are pulling evenly in through there. On this middle image and through here where it says B, they're showing that this muscle, if it gets tight, can result in pulling that hip closer up towards your spine. So you can see the spine is still reasonably straight, but all of a sudden one hip is elevated. So we'll see this commonly in dancers where their hips won't look level anymore, like one will look kind of lifted compared to the other one. The other thing that could happen is if our pelvis ends up staying level. So if you look at the image on the right, that one that's labeled C, the hips stay level, but now you can see that the spine's having to kind of tilt or curve towards that side because that muscle's tight in through there. So this can happen with any muscle up and down the spine. So we'll sometimes see it as uneven hips. We'll sometimes see it as uneven shoulder blades. You'll see one shoulder's really like kind of raised up compared to another one. You'll start to see these asymmetries develop. And like I said, oftentimes it's just a result of the training that we're doing to sort of practice certain choreography over and over again. So for these, what we really want to do is work on rebalancing those muscles. So lengthening the shortened muscles, strengthening the long muscles to really like even out the spine. Because over time, if we leave somebody like this, they're not going to look very symmetrical. And in dance, that aesthetic of symmetry is often important, but also people will often develop pain over time. So not necessarily initially, but over time, if we allow these imbalances to sort of persist or to even get progressively more exaggerated, people will start to develop pain on one side where one of the muscles is overly tight or that sort of thing. So we want to try and even out those muscles before it becomes an issue for those dancers. So those are just two sort of common back things that we see. So the spondylolisthesis and the functional scoliosis. We're going to move down into the hip, and I'm going to talk about snapping hip syndrome. So this is sort of like a catch-all phrase that we use that dancers are often very familiar with, and they will come in and they will say, I don't really have any hip pain, but every time I kick my leg or every time I développé, I get a snap or a pop or a click or something that happens. And in some dancers, it happens on the way up and the way down, and some people it's only on the way up, or some it's only on the way down. Very commonly happens with the leg going to second more so than like the leg going to the front, and very rarely happens when your leg's going to the back. So it's usually something that they'll report when they're kicking to the side or to the front. And we kind of term this snapping hip syndrome. But basically what it is it is a muscle imbalance that develops around what we call the lumbopelvic hip girdle. That's just a fancy way of saying like your low back, your pelvis, and your hip. They're all really connected because we have a whole bunch of muscles that actually travel between the low back and the pelvis and the hip. And if we develop imbalances that happen in these muscles, when we go to kick our leg or do other things like développé or things like that, but I'm just going to use kick your leg as an example. When we go to do that, we will get this snapping or popping or clicking or whatever that happens. Basically what's happening is the bony surfaces in our hip are not actually really smooth. There's all sorts of little kind of like ridges or bumps in through there. And we have tendons of different muscles that kind of should be able to slide like pretty smoothly around as we're moving our legs into different positions. If we develop an imbalance where certain muscles get too tight or certain tendons get shortened because the muscles get tight, or other ones become weak or that type of thing, so any kind of imbalance that happens in through there, what will often happen is instead of it being able to like slide really smoothly, it will kind of like twang back and forth. So it's almost like an elastic that's been drawn really tight and it's like twanging in through there. And that is often what that kind of click will be symbolic of. I'll show you just one example of just the anatomy in through here. So you can see where all of those muscles kind of all intersect with each other. So the image on the left here is actually showing some of your deep hip flexor muscles. So it's showing you your psoas muscle, which is the one, I don't know if you can see my cursor, but hopefully you can, that actually attaches to your spine. So to these vertebral bodies, like to your spine, but then it comes all the way through and comes all the way down and attaches into your hip in through here. And then this is your iliacus muscle, which comes down and joins that psoas tendon. And we often call this our iliopsoas muscle. This is a super important muscle in dance because this is the muscle that allows us to keep our leg up in extension. So this is like our leg extension muscle. But if we have imbalances that develop through any of the muscles in either the low back or the pelvis area or the hip area, then the dynamics of these muscles can be altered. The image on the right is just showing you some of the other muscles that all attach into the hip. So if you can see my cursor, this is that iliopsoas that we were just looking at on the other image, but there's this muscle that comes across the front here. There's this muscle, which is also a hip flexor muscle. There's part of your quad muscle in through here. So there's a lot of muscles that all play into our hip and pelvis movement. One of the most common imbalances that I will see in dancers coming in with this kind of snapping hip thing going on is that they often are not using their deep stabilizer muscles as efficiently as they could be. And so they're tending to use some of their big global muscles. So these are our big muscles like our quad muscle or this hip flexor muscle in through here called our TFL muscle, muscles like that. They're using them more than they should be. So those muscles are getting overworked. Some of the deep stabilizer muscles are being underworked, and you get this imbalance that develops and this kind of clicking that happens in through there. Snapping hip on its own is more of an annoyance than a really big problem. Like most people will say, oh, it doesn't really hurt, but it's just like annoying every time it happens. My teacher always looks at me because she can hear me from across the room or whatever. But if we leave this untreated, eventually over time, it can develop into like a tendinopathy. So you can develop irritation in the actual tendons and specifically in these like iliopsoas tendons, but it can happen in other tendons as well, where it can become like inflamed or irritated and it will then become painful. And that becomes a much harder issue to treat. So we really want to address this issue when it is just the annoying snapping hip syndrome and it hasn't turned into like a tendinopathy, so that we can prevent it from progressing to that. And really the treatment for this is to really work on restoring the mechanics and the muscle balance in the muscles around the hip. So making sure that we're using the muscles appropriately with different moves that we're doing. So whether it's jumping or kicking or developing or turnout or whatever, just working on that muscle re-education and muscle balance in through there. So this is something that a lot of people tend to ignore, but I would encourage you, if you are experiencing like a snapping hip type thing, to try and get it looked at by a dance medicine professional so that they can assess the muscle balance and what might be working harder than it should be and what might not be working as efficiently as it should be, just to address that. We're going to move from the hip down to the knee, and we're going to talk about something called patellofemoral pain syndrome. So this is just a fancy way of saying pain in the front of your knee. So this is pain that most dancers will report in the kneecap area. Very, very commonly, we'll see and hear dancers report this pain during times of growth. So I see it the most during dancers going through like adolescent growth spurt. And it also is something that develops due to a muscle imbalance surrounding sort of the knee and the muscles that attach into the knee. So normally our kneecap, I'm just going to use my fingers again, but sits in a little tiny groove right on the front of our leg bone. So our kneecap sits right in there. And as we bend and straighten our knee, it slides up and down really nicely. There's cartilage in through there. It should be really smooth. It should slide really easily. What can happen with a muscle imbalance? I think I have a picture of this as well, but what can happen with a muscle imbalance is rather than it being able to slide really easily up and down this groove, it gets pulled to like one side or pulled to the other side, and rubbing and kind of irritation can occur. And if that happens once or twice, it's not a big deal. But if that's happening over and over and over again with every step that you take or every landing from a jump that happens, you're going to end up with irritation and inflammation in that area, in through there. So again, anything that is a result of a muscle imbalance, the treatment for that is to correct the underlying muscle imbalance. Oftentimes in knee injuries, and actually I would probably say the vast majority of knee injuries actually happen from things coming from either above, so in the hip or pelvis area, or from below in the foot area. So we're always going to be looking above and below the knee to see if there's things happening from a muscle perspective there that are influencing the mechanics of the knee. And one common sort of example of this is if you have a dancer who really, really rolls in through their feet or pronates in through their feet, when they go to do a plie or land from a jump, it's going to be a lot harder for them to have their knee lining up with their foot, and they're more likely to let their knee collapse in or roll in. And over time, that could cause irritation in that patellofemoral joint or that kneecap area in through there. So patellofemoral pain syndrome, really common, very much associated with growing a lot of the time, but we do want to address the underlying muscle imbalance that's causing it, so that we are decreasing how much irritation and pain is happening in through there, and making sure that we're also not then going to end up with other injuries that are associated with some of those mechanics that might be happening in through there. So there's lots of other things that can happen at the knee. Knee pain and knee injuries are common in dancers, but I think that's probably like the most common one you'll see is people just coming in reporting that like anterior knee pain, that, oh, I didn't really have an injury, but it's gotten progressively worse, and it hurts when I jump, and it hurts when I go up and down stairs, and that kind of thing. So moving on from the knee, we're going to go down to the foot and ankle. And the last thing that we're going to talk about today is something that's called a posterior ankle impingement. So this is pain that the dancer gets in the back of their ankle, very often in kind of like the Achilles area. And this is one that is really, really, really commonly misdiagnosed as an Achilles problem. So people will come in and say, oh, I have like Achilles tendonitis or tendinopathy going on, or they'll even go to like their family doctor, and the family doctor will say, oh yeah, you have like an Achilles problem going on. So they'll treat it as if it's an Achilles problem and do like the exercises and the rehab and stuff, but it doesn't get better. And it's because it's actually a different problem going on. So I'm not going to talk about Achilles issues, although they are common in dancers as well, but I'm going to talk about the posterior ankle impingement because it's one that often is missed or misdiagnosed if you aren't seeing somebody who's really familiar with dance. So in a posterior ankle impingement, what is happening, and in fact, I have a little foot here so I can show you this. There's two different types of impingement. But what is happening is when we point our foot, so if we imagine pointing our foot down this way, or specifically going on to demi-point and point, so we see this really commonly in ballet dancers, more so than probably any other genre of dancers, what happens is the ankle joint has to slide back into this position. Can you see that there? And then it comes back as we're pointing our foot or going up on demi-point. And in some people, depending on the shape of their ankle joints or a whole host of other factors, what can happen is you can get pinching that happens in the back here. So there's two different types of impingement. One of them can be, I don't know if you can see this super well, but the actual bone in through here can get pinched between the other two bones. Or there can be soft tissues, so tendons, ligaments, things like that, most commonly tendons, that can get pinched in through there as well. So we either call it a bony impingement or a soft tissue impingement in through there. With the bony impingement, there are some people who have a little extra bit of bone on the back of their ankle here that's called an os trigonum, and they may be more susceptible to having this posterior ankle impingement here. The big difference between a posterior ankle impingement and like an Achilles problem is that generally with an Achilles problem, people will report some pain and discomfort if they go on to like releve or demi-point, but they will also report pain and discomfort if the tendon gets really stretched. So if they go into like a stretch position, like a calf stretch or landing from a jump or things like that. With these posterior impingements, they're going to get a lot of pain when they go into this like demi-point or just pointing their foot sometimes, or like actual like full point on full releve, but they generally do not have pain in a stretch position because you're actually opening up the back in through there. So they're not going to feel that same pain when they go into a stretch position. There are other clinical ways of differentiating between the two of them. That is like certainly not an exhaustive way of telling if it's Achilles or posterior impingement. But with this posterior impingement, the treatment needs to be slightly different because it's not necessarily a tendon issue. It can be a physical structural issue. Posterior impingement will quite commonly show up after people have had a ankle injury. So they'll have an ankle sprain. They might do a little bit of rehab, but maybe not quite as much rehab as they should have. And then they'll get back into dancing. And then a little bit later, either weeks later, or sometimes even a few months later, they will start to develop this pain in through the back here. And that happens because potentially the mechanics of the foot were altered in that initial injury. So one of the big things for treatment of this posterior impingement is making sure that the movement in all of the joints in the foot, and there's a lot of joints, there's 26 bones and 33 joints in the foot. So making sure that all of that is moving really well and everything's articulating properly, and then making sure that we have correct muscle balance in the foot so that the ankle muscles are working appropriately, and then all the little tiny muscles in the foot are also working appropriately. So for soft tissue impingement, we generally can treat it conservatively. So we can help people with muscle reeducation, with strengthening and different exercises. In some people with the bony impingement, I think I might have a photo of the bony impingement here, but with some people, if they have that bony impingement and they have that little extra tiny bit of bone there, so you can see where it says os trigonum and there's like an arrow pointing in, there's like a little bit of extra bone in through there. In some cases, they will go in and surgically correct this. And by that, I just mean they go in and like remove that little piece of bone. So oftentimes we can treat this problem conservatively with like rehab, but not necessarily 100% of the time can we treat it with rehab in through there. So again, I just wanted to bring your attention to this specific injury because it's one that's commonly confused or misdiagnosed with an Achilles problem, but really it's an impingement or a pinching problem in the back, and the mechanics of it are a little bit different in through there. So that is all of the injuries I'm going to go through today, just for time's sake. And like I said, it's certainly not an exhaustive list, but I just wanted to bring your attention to some injuries that are maybe not as common in the general population, but that we see very commonly and specifically in competitive dancers who are using their bodies a lot, training a lot of hours, and doing sort of very high level athletic endeavors with their training. So thank you so much for tuning in today. If you want to connect with me, I'll leave this slide up for a minute, but you can reach me by email. That is my clinic website there, allegroperformance.com. I'm quite active on Instagram at DancePhysioErica, and I'm also on Facebook, although slightly less active there. So feel free to reach out, give me a follow, send me any questions or any comments that you have, and thank you so much for tuning in.
Hi, my name is Dr. Tracy Ferguson. I am a physical therapist with Sugarfoot Therapy. I work in Los Angeles, which gives me the opportunity to work with competitive dancers and professional dancers. I myself grew up as a dancer, so I absolutely love this, and being able to share my both worlds with you is what I'm here for. Today, I'm going to share with you my top 10 exercises for contemporary dancers. Okay, so for our first two exercises, I would put these in a warm-up category. These are important because it helps get the heart rate up, gets the body warm, starts making that tissue more extensible. So these are great replacements for our standard stretches that we do in dance. So our first one that I want to show you is our deep squat with lifts. These are great hip openers that are going to get you a lot of mobility in your hips. So you're going to lower down into a wide second position. In this position, you want to push your arms out into your knees and your knees into the arms. It's going to create just a nice pressure and activate all of the muscles here. Once you hold this, I want you to lift up. You go a slow count of 2 on the way up, and then a slow count of 2 on the way down. With this, it's really important to make that contact stay within the knees and keep everything nice and active. You want your back nice and flat on the hip lift up, and then also slow and control the way down. And you can go as deep into a squat as you can control without just sinking in and hanging out on those joint capsules and ligaments. So it's nice and active the whole time. Good. When you come out of this one, it's hard to just stand right up, so it's important you can place your hands on the ground, lift your hips up, and then come on up. This one you can do 2 sets of if you feel like you need a little bit more opening in the hips, but about 5 to 10 repetitions per set. So our second exercise is our sliding splits. So this is a great alternative to hanging out and just sitting in a passive split position. This one really works on control. So we're going to be sliding out into our split, and the first round you'll see Katie stopping at different points. This is to show the muscles how to contract and activate. That way it can kind of work like brakes on the car on the way down. So they'll make sure you're nice and stable when you're doing your leaps, jumps, bottom-mas, kind of everything that is in that split position. So you're going to start kneeling with one foot. And in this position here, you'll see she has a little mat just to help her slide. But what I'll have you do is just going to start to shift your weight forward, sliding into that front leg, into that split position. You're going to hold. Then you're going to go down about another inch or 2 and hold. So you're going to progress this all the way down. Every couple inches of movement, just squeezing those legs together to make yourself stop, and then to continue the movement down. Good. You want to go as far down in the split as you can stop it and control. Good. And then when you get to the bottom, you can kind of work yourself out of it and then reset back in the starting position. Okay. And for this second repetition, this one is going to be a little bit harder. So if you had a challenge with that first repetition, continue to do the same type of motion. So for this one, you're going to get into that half kneeling position with the leg kicked out. And the difference here is we're going to slide fully out into the split and then pull it back as far or back to the starting position. When you slide out, only go as far as you can control it and as far as you can pull back without arching through the low back to come up or using your momentum. So this is all coming from just like that squeeze of the hip flexor and the hamstrings on the way out. So that control lowering down and that squeeze together to come all the way back up to start. For this one, it's one you want to perform on both legs, and you can do about 5 repetitions of it just to get that opening and that elongation of the muscles. Great. So it's important for us to work our upper bodies. Oftentimes, dancers, we really focus on the lower half, which is definitely important because it is a lot of times where we get hurt and where a lot of our movement comes from, especially in contemporary have floor work. And with floor work, it's really important that we can support and transition through our upper extremity and find that stability from our core. So it's very important to give equal attention to the upper body as well. You'll see us in a few of these exercises also working through 3 planes of movement. So these 3 planes are going to be our sagittal plane, which is a forward and backwards movement, frontal plane, which is side to side, and then our transverse plane, which is rotational. It's important that we address these 3 planes when we're doing exercises because we are 3D beings and dance is 3D, so we have to practice and train in all different directions. For our third exercise, we're going to do some core and also a little bit of upper extremity stability. So with this, we're going to get into a plank position, and we're going to do what we call a 3-way plank with a hip driver. So what hip drivers mean, it just means your hips are going to initiate the movement. So go ahead and get into a high plank. So hands and wrists are straight underneath your shoulders, as you can see with Katie. And then she's a straight line all the way down to the heels, and she's pushing energetically out through those heels. One thing to note for form here, she's going to be actively pushing away from the floor. Sometimes sink into their shoulder blades like this without much muscle activity. So you really want to push as far as you can away from the floor, keeping that nice straight line. And then from this position, we're going to go through 3 planes of movement. Our first one is the sagittal plane. We're going to be moving forwards and backwards here. So she's going to be lifting her hips high up and then going down past the plank as well. So it's that transition through these 2 points. The important thing to note is there isn't any arching or bending at her back. It's staying almost as if she has a rod through the spine the whole time. And it's that active push through the hands throughout this full plane of movement. Good, and we're going to find our center position back in our tall plank. Here we're going to move through the frontal plane next. So our frontal plane is going to be side to side. And with this, you want to just shift your body weight from one arm to the other, keeping everything nice and level. So you don't want it to start to look like a rainbow. You want to just slide smoothly across. Good, keeping that active push away from the floor. And then we'll recenter back in that high plank. And then we'll do our third plane of movement, which is going to be a rotational plane or our transverse plane. So this one, we're going to be dropping one hip down and then come back up and then transitioning to the other side. Good. Again, keeping that active push away from the floor and keeping that nice straight spine. Good. So with these, you can do about 8 to 10 repetitions in each plane of movement and going about 1 to 2 sets of that depending on the amount of time you have. So our fourth exercise, we are going to do a shoulder stability movement here. So this one we call prone A's, T's, and Y's. So we're going to transition through these 3 different positions, and we're going to be working a lot of the muscles in our back and near our shoulder blade. So with this, you want to lay on your stomachs. You're going to push your forehead down into the floor. This will activate and support the neck. And then you're going to have that pelvic tuck under the floor to activate your core. So we're nice and stable in the center of our body. Our arms are going to start low like an A. And from here, we're going to lift our arms up, really squeezing from the shoulder blades. And you're going to transition your arms out to about a 90-degree angle like a T and set them back down onto the floor. And from here, you're going to lift up again. And we're going to transition them up as in a Y and then lift them down. And then we're going to reverse. So we're going to go up and back down, and then down to our A at that 45 angle and down. So with this, it's important to watch the shrugging of the shoulders, keep that space nice and open, especially as we transition up into the Y. It's really common to come up in here and to get a little too much activity from our upper trap. So we're focusing on that mid and lower trap for these exercises. And for this one, doing about 5 to 8 repetitions is perfect. You're going to get good shoulder mobility, really activate all the muscles that are going to keep us nice, strong, and stable so we can use our arms for reaching or supporting ourselves on the floor. Good. For our 5th exercise, we're going to be doing a banded overhead reach. So with this one, you want to grab a light mini band. This doesn't need too much resistance. And if you don't have a mini band, a TheraBand works great for this as well, either into the light, or medium levels. So with this, you're going to put that band about at a watch spot on the forearm. You're going to push out into the band, keeping that tension, and you're going to start to reach up overhead, and you want to move as high as you can without readjusting the shoulder blades. So it's, again, very important to keep that space nice and wide between the shoulder blades and the ears. This one is a great activator for those upward rotators of our shoulder blades, which help us transition and move on the floor and also reach. It activates our rotator cuff, which is very important for stabilization for our shoulder. This is a nice, easy exercise to go into. It definitely makes those muscles talk to you very quick, so about 5 to 6 repetitions of this one, and you'll feel like your shoulders are awake and ready to go. This one, a compensation we might see as you start to get up, not only might you reach your shoulders up, but there's a certain tendency to overarch the back and to let the ribs flare. So it's very important to keep the ribs down, almost in line with the hip bones. So you want to think of something just cinching those together, maintaining that core activity and that just full pressure and activation in the body as you reach up and overhead. So your whole body is working to contribute to that push and that reach. Yes. For our sixth exercise, we're going to shift down into our lower extremities and work on some pelvic stability. So for this one, we're going to do what we call our standing clams. Medium band, and we're going to be putting it above the knees. This one, we're working mostly on our glute med. This is a muscle on the side of our hip that is very big for pelvic stability. It is super important for standing on one leg, so turning, any sort of balance that you need to do. This is your feet slightly wider than hip width distance. I'm going to have you sit back into a mini squat, so a slight hip hinge here, and you want to think about your hips going back. Dancers, we tend to be very forward. So it's important to really think about the hips shifting backwards the whole time. So the knees don't go any further forward than what would be like your shoelaces. And so from here, what we're going to do is you're going to drop one knee in and kind of resist the band on the way in. And then you're going to push the knee out. And with this one, you're going to pass that midline and push a little out, but you don't want your foot to roll open. So keep the ball of the foot firmly planted on the floor the whole time. And you're just going to transition between those two positions, that inward and outward push. And you're activating that moving side. So with this one, we can do about 5 to 8 repetitions on one side, and then we're going to transition into the other leg. Your core is nice and active. This is another one you want to watch that rib placement and make sure it's tucked in and in line with your hip bones. Only thing moving here is going to be your knee. So once we do our repetitions on each side, we can take a slightly wider stance. So readjust your feet, and then you're going to shift all of your weight over to one side, leaving that trailing leg nice and straight. And this again is with the hips backwards to really focus on glute activation over quads. So we're going to take the knee on the side we shifted towards, and this will now be our moving leg. Good. Watching on this one, especially with the wider stance, your hip's going to want to drop on the side that we're shifted towards. So making sure everything stays nice and even throughout the movement. Then we'll switch sides. Same thing as you transition, hips stay level, and you'll get a nice burn in the outer hips. Good. So our seventh exercise is going to be a hip airplane. This one's really important for trunk control. It focuses a lot on core activation, and it kind of helps us stay out of our lower back. But the most important is teaching our body how to rotate and initiate from our hips. So this is going to be very important with turns, with any transitional movement from a single leg to double leg or double leg to single leg. So this we will use all the time when dancing. So to start off with this one, you're going to be getting into a parallel arabesque or like a warrior 3 stance. Arms can be out to the side, whatever feels comfortable for you. They can be at the hips to try to feel for that motion, or they can be in front in like a first position, whatever is comfortable for you. And from here, I like hips personally. We're going to rotate. So you'll start by rotating up and open, keeping your stance knee pointing straight the whole time. And then you're going to come back to a parallel position to the floor. And then we're going to go in the opposite direction and we're going to turn inwards. So it's very important to keep, again, those ribs down, cores active, and we're rotating our pelvis around our stance leg. Good. This one takes a lot of time and control. Often people will start to lead with the shoulders. You really want to focus on this only coming from the hips and not translating down into the knee. Good. And this one you want to do on both sides. About 8 repetitions of this one will get you that good neuromuscular control and really wake up all of those muscles around that hip joint. So again, it's creating stability while also increasing your mobility as well. Beautiful. For our 8th exercise, we're going to be doing an ankle inversion, eversion, and releve. So those are pretty fancy terms for like a roll out and a roll in. almost like that like beveled sickle position. This one's very important because the most commonly injured spot in dancers are our ankles. So we want to make sure we protect that ankle joint. What this exercise will do is not only are we kind of getting the strength that we want in a releve, we're also giving our body a plan. So it knows what to do if in case we roll out, it knows how to effectively pull ourselves in. So for this exercise, we have a light band at the ankles, kind of right at the sock line. And we don't need a heavy band here because again, it's just for a little bit of a cue on our range of motion. So you're going to rise up into a releve in parallel. You're going to keep your weight over your second toe, and we'll start by shifting way out, almost as if your weight's going over your pinky toe. Go as far as you can without pain, and then you're going to bring the legs back up into a center position, almost like pulling and resisting the band. Once we find a point, we're going to shift our weight over our big toes. So we're going to go the opposite direction, almost pushing, kind of guiding the band in. And we're going to transition through those two positions. So with this, that nice and smooth out, and then that find back into center, so that pull up and in, and then that shift up and over the big toe as well. So with this one, check where your stability is. It doesn't need to be in your highest releve. It can be lower if this is new and it's something you're not quite used to. And so once you get more accustomed to it and a bit more stable, you can rise into a higher releve. For this one, repetitions, you can do, it kind of depends on how your balance is feeling that day, but I like this one into like the 8 to 12 range because it's a bit more of an endurance neuromuscular activator. So it's activating all those muscles around that ankle joint. Great. Okay, so our last two exercises we're going to do are going to focus on jumps. So our ninth exercise is going to be what we call snap downs. It's really just a way to teach your body how to land a jump because it's very important to be able to land a jump if we're doing a big trick because more often than not, injuries occur in the landing, not in the takeoff. So with this exercise, you're going to start by going up into a releve and kind of bringing yourself up as if you're going to be high. So think of that lift up out of the feet, and then you're quickly going to snap down. Good. So you kind of want to feel like you're landing the biggest jump that you have in that active, quick down. With this one, you can see Katie has a band just above the knees. We're using this as a cue. So she has to actively push her knees out into that band to get that glute med and pelvic stability and that knee stability while landing. Good. So with this one, this is our base level, but this could be as far as you go if it's already wobbly. We can do about 8 to 10 repetitions of this until you feel like you have the mechanics down. You really want to send the hips back on your landing so you're not upright. So again, we're using that hip control and those glutes. If this is looking stable for you, we can go one step harder. So what we'll do, we're going to go what we call a 2 to 1. So we're going to go up on 2 legs and then snap down into 1. Again, both knees are still driving out into that band to watch for that knee drop inwards. So up and snap, exactly. So this one, if the first one is good for you, you can do about 8 to 10 with this one as well. Getting the hips back on your landing and finding a lot of control and stability. Good. This one's very important because when we land, most of our jumps in dance are going from either one leg to one leg or from 2 legs to 1. And on one leg, very often we'll land with a drop in at the knee, which puts a lot of strain on the ligaments and the structures within the knee. So finding stability is often more important to practice than how big your jump can be because the jump will come. You need to know that you can slow it down and land it. Great. So our last exercise, our 10th exercise, is going to be 3-way jumps. So we've worked on control, we've worked on core activation and activation around the hips. Now we want to put it into practice. So we're going to jump in our 3 different planes of movement. So we're going to start with our sagittal plane of a jump forward and backwards. We're going to be going that 2 to 1 that we just practiced in our snap downs, or if you did the 2 legs to 2 legs, you can do that in this jump sequence as well. So we'll start with the band again to give that cue. We'll show you a couple repetitions with 2 legs and a couple repetitions of going from 2 to 1. Good. So it's the same mechanics on her landing that she just did in her snap down, but we're getting a little bit of that power up. The distance doesn't matter. It's as far as you can control or as small as you can control. The height doesn't matter. Again, it's as much as you can control. Something you can progress as you get better. And then we'll try the sagittal plane. Good. Nice and stable landing, no wobbles in the knees. Good. So doing about 5 to 8 of these will be a good repetition for you. Good. And the next plane we'll do is our frontal plane. If you remember, that's our side-to-side motion. So with this one, we'll show you a couple repetitions of the 2 feet jumping and the 2 feet landing. Good. And then back to center. Perfect. So with this one, it's getting that equal push off on both feet and equal landing on both feet. So it doesn't go one then the other. And the progression of this would be that 2 to 1, where you're going to jump from 2 feet to 1 foot and land. Hips stay level. The tendency will to be lifting up and also getting the point where you're losing that hip hinge. So really focus on sending the hips back. Great. Again, about 5 to 8 repetitions. And now we have our last plane, which will be our transverse. So we're going to rotate. So for this one, starting with just as simple as a 90-degree turn, but the amount you rotate all depends on how stable you're feeling that day. It can be as small or as big as you feel you can control. So we'll start with just a couple repetitions of our 2 feet to 2 feet, finding a rotation. Good. Landing and coming up from the floor and landing with 2 feet at the same time, not going one then the other. Great. And then we're going to do our 2 to 1 as well. Good. This one really watching that hip hike, so keep everything level on the landing. Drive both knees into the band. Good. So those are my top 10 favorite exercises for contemporary dancers. So you have the options of using this all 10 exercises as just one conditioning program. You can kind of pick out a couple of your favorites or ones you felt were hard. You can incorporate them into a conditioning program you're already doing or into your classes or warm-ups. And if you want to check out some more dance conditioning made for you by physical therapists, go ahead and check out Sugarfoot Therapy.